there is a looming strike in the health sector as the Nigerian Association of Resident Doctors has given the federal government 2 weeks to meet its demands, which includes 200% salary increment. This comes 7 weeks after the end of a 5-day warning strike embarked on by the association in May. The resident doctors insist that no implementation of the resolutions of the conciliatory meeting chaired by the former Minister of Labour and Employment, Chris Ngige, has been done, despite the set deadlines for their implementation. In addition to the 200% salary increase, the doctors are demanding upward review of the associated allowances, implementation of one-for-one replacement of clinical staff who have been lost due to brain drain, as well as the release of the implementation guideline by the Office of the Head of the Civil Service. These were decided at the association's virtual Extraordinary National Executive Council meeting. This new ultimatum will end on 19th of July this year. I have joining me President of the Nigeria Association of Resident Doctors, NARD, Dr. Orji Innocent. Good to have you join us.
Thank you for having me.
So we understand that the latest ultimatum coming from NARD is as a result of the MOU signed with the federal government, the then Buhari administration, on the 19th of May, and that you have said that you're looking at the extent to which that particular MOU has been implemented. Talk to us about that. As you go through it, what has been done and what has not been done?
Thank you very much. Unfortunately, we are back here again, and just like you rightly said, we signed this MOU more than just about 2 months ago, with timelines as to when most of these issues will be resolved. Unfortunately, none of them has been addressed. None. Even the circular on one-for-one replacement, that the MOU, it was clearly captured that it should be released on or before 5th of June this year. That we are now a month after that, it has not been released, and the hospitals are still depleted of clinical staff. You know, it's a very serious issue. We're also talking about the medical residency training fund for this year, which they kept promising us since March that it will be paid. You know, it was also stated in that MOU that it will be paid once the fiscal year for 2023 becomes operational. And we are told that started last month. But up to now, it is yet to be paid. And a lot of other issues, you know, salary arrears dating back to 2016 and 2015, you know. And the major issue is that we just feel that government should not just sign a memorandum of understanding and refuse to implement it. You know, even during the meeting yesterday, our members were not happy at all. You know, it almost led to an immediate strike, because you recall that we have given ultimatum on these same issues severally. It was more of an appeal that we kept making, that they should give this new government some time, you know, for them to address it. And that's how we came up with the 2 weeks ultimatum. Otherwise, it would have been an immediate strike. But we believe that within these 2 weeks, this current government has the capacity to resolve most of those issues in a matter of days.
Mm. And there are lots of people who empathize with you because, I mean, like you just mentioned, a lot of these issues have been ongoing for years. Until now, they have not been resolved, and you have, you know, more issues piling on top of that. And we know how, you know, there is an emergency in the health sector. But you also mentioned that, look, people are saying you should have given you should give this government enough time. You have said you've given them 2 weeks. This is an administration that is barely 1 month old, hasn't set up its cabinet. And so people are wondering, why wouldn't you give them enough time to settle in, at least have their cabinet together before you give this ultimatum?
Okay, so there is nothing in that MOU that needs the presence of a minister to be implemented. Like you read in your opening statement, the circular on one-for-one replacement is the Office of the Head of Service that should release that. You know, it's not a minister. The medical residency training fund for 2023, all the paperwork has been done. It was also captured in 2023 budget. You know, all that is required now is for the funds to be released for it to be paid. And we are already in July. So these issues are things that we believe. And incidentally, that MOU was signed by permanent secretaries of all the relevant agencies involved when we had that conciliatory meeting. It was deliberately made so because the then government knew that they were going, and so they insisted that it will be those who will continue to be in this current government that should sign that MOU, and that was what happened. So we are so confident that if they look at that MOU, there are so many issues there that can be addressed within days. Then the other long-term issues we can continue to discuss, and then we have their own timeline as to when they think they will be able to resolve them. So these are not major issues, but the truth is that they are affecting our members. When you don't have doctors and nurses in the hospitals, you have it certainly leads to work overload, burnout effect, and our members are breaking down, they are dying, and every day people are still leaving the system. So they need to urgently replace those that have left so that the system will be functional again.
And you're also asking for 200% salary increase. One people might say, look, how realistic is that, in this particular economy? But we know that in the coming days, we're likely to see dialogue between your union and the federal government. I will see how that plays out. Thank you so much for talking to us. President of the Nigerian Association of Resident Doctors, Dr. Orji Innocent.